Before we begin this episode, I want to provide a disclaimer, as I will be discussing the topic of mental illness today in this episode. Some of the content may contain trigger words or sensitive topics that could be upsetting to some listeners. I want to encourage you to prioritize your well-being, to approach this episode with caution if you think it may be triggering for you. If you find yourself struggling, please seek support from a trusted individual or a mental health professional. Your well-being is important to me, and I want to ensure that our content is going to be as respectful and considerate as possible for our listeners. Please take care of yourself while you're listening to this episode. And remember, I love each and every one of you. You're important to me. Now enjoy the episode. Welcome back, listeners, to Learning from Friends. My name is Kate Curtis, your tour guide in this lovely adventure that I like to call Learning from Friends. I am so glad that you have taken the time out of your day to sit down with us and enjoy some good conversation. As you all know, before we can go into our lovely topic and things for today, we got to do my mom's quote of the day. So, Mom, take it away.
Your journey is not the same as mine, and my journey is not the same as yours. But if we meet on a certain path, may we encourage each other.
Wonderful. Thank you, Mom, for having that lovely bit of advice to be able to bring us into this episode today. So to give you a little bit of introduction to here, what we're going to be talking about today is we're going to discuss how mental health really impacts more of us in so many more ways than we ever realize or willing to admit. And we're going to talk about this because there's so much stigma and labels that go with this. And my guest today is Tori. He's going to join us here on the podcast to be able to discuss this. Tori, welcome to the podcast.
Thanks for having me.
Dude, I am so excited for this. It hits very close to home for me as well because I grew up in my family of mental illness on both sides of my family that they kind of struggled with. And it's whenever you were saying that, hey, you reached out and said, hey, thank you for doing what you're doing. You're doing a good job with the podcast. And I reach back and go, hey, come on, let's do a podcast here. And as soon as you started talking, I go, oh man,
yeah,
this will be fun.
This will be fun. It will be fun. Try to keep it, me, I'm always about a good joke. The only thing worse than dad humor is nurse humor. So
hey, I love them both.
It'll be lighthearted. But I do think that, once we started kind of like talking about this and just the platform and things like that, I was like, well, here's kind of like what's been going on in my life professionally and personally, and the things that like blindsided us, like me and my husband, that just totally wasn't expecting.
You never can tell when it's going to hit.
Yeah.
I was in elementary school when my dad started having his first episodes.
At the beginning, I kind of like felt like I overshared with friends almost. Mm-hmm. And then so that took a lot. And I had to kind of like take a step back and really kind of like figure out how to hear my own voice and things like that. But then as I started to get comfortable with sharing again, people were just kind of like, oh my gosh, like, I don't know how you do it. And I'm just like,
you just do.
You just do. Like, you don't have an option. It's not like, let me trade them for something else. Like, yeah. So I think figuring out how to navigate some of those things and not being as blindsided and happens by like each of us being willing to share our stories. And this is what I experienced, and this is what helped me, or this is what helped this person that I know. And because, there's good opinions and there's bad opinions, but
yep, that's a true statement.
You need to hear all of them to decide which one's going to be yours too.
Yes,
so
decipher, be able to have the opportunity to get information. Because for so long, again, growing up with my dad and mother dealing with all of that was taking place, there wasn't a lot of information in the late 90s,
people are scared to talk
early
about
2000s. It. There wasn't. Just getting recently into the early 2010s is when mental illness really started to boom, where people were willing to bring it out into the open a lot more. And that's just amazing that you're willing to come on and share this with us.
Yeah.
And for those listeners that are looking for a little bit of some information as well of some other stuff, is go back and listen to, I have a friend who did postpartum psychosis episode early on in one of the episodes. I had my father-in-law come on and talk about his cancer experience. There's past episodes and stuff out there as well that if you're curious about, and there's other resources out there. Look, type in Google now can be a blessing and a curse, but find some information.
Definitely a blessing and a curse.
Tori, how do we know each other? Where's that back? I always learning from friends to try to tie it in.
My easiest answer is band.
Okay, that is.
I don't remember what year that was because that's been a while for both of us.
I'm gonna date us here. I think that was year 2006.
Yeah,
whenever
that sounds
you were
familiar.
Yeah, you were a freshman when I was a senior.
Freshman, yeah.
So 2006.
And I just remember being like, I just really remember, like, I don't really remember a whole lot about high school. I don't know if you do.
I surprisingly have a lot of memory about high school. I don't know why.
I definitely don't really remember a whole lot about, like, being a freshman and things like that. But I do, like, have very distinct memories of you and just being, like, this, like, carefree, just like, oh, like, I don't know, hippie for lack of a better term.
That
like,
hits the nail on the head. Right there.
And it was just like, you just didn't care. And you're just like very relaxed and things like that. And like, so I don't think I've ever thought like anything negative about you, like ever.
Yeah.
And I know, right? Like, and that's hard to say about somebody because especially like in band or something where you're around people for a long
Constantly,
time, you're going to make opinions about people. And high school is probably the worst place to. Maybe middle school's worse.
Middle school, I teach middle school.
High school just a little bit better, maybe.
Yeah, just a little bit.
But that's like, you get really harsh opinions and things like that. So I think too, like finding somebody like you that is just really open in general is like it's a lot of positivity.
Yeah, and it worked out in the saxophone section. We had a lot of competition of people who wanted to be towards the top. And I remember always making the comment, goes, I want last chair. I don't want first. Don't make any expectations on me. Just let me be here.
And it sets the table too, though, because, right? So, like, because you feel like anytime you're coming in and you're new to any situation, like high school or not, there's always an intimidation factor. You can say you're the most confident person in the world. And there's always an intimidation factor. So like having that person that's just like, oh, you know, it's fine. We're just going to have fun.
Yeah.
We're going to do our thing, blah, 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 blah. It makes it less intimidating and it made it more welcoming, which allowed for like the better experience and everything to follow. So, and then, and we just kind of like gradually kept up wishing each other happy birthdays and things like that.
Good old
like
Puddles pity party. Puddles pity party.
And
That's
then,
my favorite thing.
and then so once I started, working on some other things, like outside of like my official nursing career, like I was like, oh, I had kept in touch with you on social media and seen what you were doing. And I was like, and we just started talking and then we were like, let's do it. Let's make it.
Let's make this happen. And here we are. So with we have a little introduction of how we know each other. The majority of the audience does not know who Tori is. Give us a little bit of background. Like, what's a Wikipedia page summary formation here? Give us some background.
She's a goofball. No, I'm just kidding.
She's a lovable goofball.
So the biggest thing, my husband and I have been married, making me do more math. I should have done math before I came, apparently. So we've been married.
Dude, it's so hard to just do math in general.
I know. I can only do by tens. We've been married for, this will be year 8.
Hey, nice.
Yeah.
I'm going on year 9. So.
Very cool. Very cool.
Congratulations for making that long.
You too. And it's always that thing too. You're like, you get to a point when you're like, I don't know. It seems like for forever, You're like, do you want like when we started dating?
Yeah.
I know. I'm like, we're just going to have to go by 5 years at that point.
Smart.
So I always have to think back because we got married in the same year that I started nursing.
Oh, wow.
So I'm always like, okay, which one's easier for me to count, my anniversary? Because people ask you like, oh, how long have you been a nurse? And I'm like, oh, no, what year did we get married?
Yes. How can I be able to connect this? Yeah.
So I've been a nurse for 8 years. I've done a few different specialties. Emergency nursing was my big,
bless you,
straight out the park thing. And then after about like the first full year of COVID, second year of COVID, I'd kind of had enough with that. So started switching to like more kind of outpatient settings and things like that. And we just had a lot of his stuff had kind of ramped up at that point, which we'll get into more in a little bit. But so I mean, it's just him and me and the 4-legged critters. You know how that goes.
Yeah, cats, dogs.
We have 3 heathens. That's what I like to call them. Yeah.
I can't use the language that we call my cats from time to time.
Yeah, we have the 3 heathens.
Boopers was that's the nice word for them.
Yeah, so we have 3 little dogs. They're not little. They're medium sized. We have 3 dogs, and they keep you on your toes. I tell people all the time because, patients and things like to make small talk. People are always like, that's the first thing that I'm sure you get a lot too. It's like, oh, do you have any kids?
Yeah.
And it's always, you're like, I don't really know how to answer the question because I don't want to divulge my whole life story to you in this 5-second interaction either.
True.
But sometimes I tell people that the only things that I have patience for between the dogs and my husband. That's it.
Which is a fair way to, it's a good icebreaker, but it's also a good letting you know this is where I'm kind of at in my comfort level.
And then usually people want to talk about the dog. So it's like, great, let me tell you about my heathens.
Let me tell you about them. We can have a conversation for an hour about that.
Yeah,
perfect.
Exactly.
Yeah, because I mean, I can only imagine trying to go through and communicating with people on different levels whenever coming in for, hey, coming into the emergency room and being like, oh yeah, like my arm's bleeding everywhere. So let's have some quick conversation. What can we have like in order to keep you calm? Or you're just
like trying to be like, oh, here, let me help get you out of here. And you run them to the car and they're like, so do you have any kids? And I'm like, I've known you for 2 seconds, ma'am. I don't even know your name.
But you saved my arm. Like, you know.
But I hope you feel better.
Yeah, exactly. Have a good day. But yeah, I have that all the time with kids and trying to make a connection with them. And you're trying to like say something quickly to somehow make that personal connection to them so they feel comfortable, at the same time not overindulging to make them feel like, okay, now I'm uncomfortable with this, but I can relate to you in some way for fashion.
Yeah.
So that's with questions.
That's why I always like to bring up the dogs, because most people can relate to having a pet, unless you're allergic, which in this case, you know. I love you, honey.
Yeah. My wife's the same way. You're lucky. She's not gonna pop up and I'm gonna go, hey, Katie, because she's not here today. So you guys are lucky today you don't get to hear my wife randomly pop up and say that. Now, my cats may make an appearance here in a little bit. Who knows? They've already had an episode, so maybe they'll be quiet and hold back. Who knows? If you get the chance, go back and listen to that one. It's funny. But yeah, I think that's always just, you know, nice little share bit of information there to give us a little insight into the world that is Tori.
Yeah, it's just a lot, you know, nursing, 8 years of nursing, 5 years emergency medicine, outpatient, and did urgent care, which is basically just emergency nursing without resources.
I love it. Without resources.
Yeah, and then it was like, oh, what doesn't have COVID? Because COVID burnout was real. So that's it. So now I do surgery stuff. So, which they all overlap, which is just really interesting too.
They're all interrelated some way, form, or fashion.
Yeah, you always keep learning and everything else too. So
if you're not busy learning, I don't know what you're doing.
Yeah.
You got to figure something out. I was going to do the Bob Dylan quote of like, if you're not busy living, you're busy dying. But I'm like, I couldn't find a way to make that work in a good way.
Yeah, sometimes I would think that's funny, but some people are like,
too much hate, you know, take that one back.
Yeah. But yeah, that health and fitness coaching, I mean, there's Tori has probably a whole Wikipedia page worth of things. So.
Side hustle, man. Side hustle.
You have to. Everybody has a side hustle nowadays. You're not in if you're not doing some kind of side hustle.
It's true. You got to make money somehow because we're not getting a lot of it right now. With inflation, with a bar of soap costing $20, you're like, wait a minute.
Yeah.
Does this like come with special superpowers or something?
Nursing, as you know, teaching that it's not for people that want to have a lot of money.
Yep. You're not going to get a lot of money, but you're going to get a lot of headaches.
Yeah.
You get a lot of headache. You got to love what you do.
You're going to make people feel better. That's what's important.
That is a true statement here. Now, we're going to go into some medical stuff here. We're going to go into all these different little things. Are there any like terms or vocabulary you kind of want to throw out there just so maybe we'll say it a couple more times, but they have some general outline knowledge there?
Yeah. So there's a few, and I'm going to throw them out there because I know that they're going to come back up.
Yeah.
So the big ones that I know that are going to come up at some point, one is going to be like a 1013. Okay. So a lot of people have heard this phrase at some point. It's commonly referred to as like the 72-hour hold, which is true, but it's not true.
It never fully is.
It's not. It's too simplified of basically saying that that's what it is the problem. So basically what that means is that, a physician is the only person that can sign a 1013. It can't be like a mid-level provider.
Gray area.
Yeah, I was going to say it can't be a social worker, but like technically they can. So, but like the first person, your first contact that's going to sign it has to be a medical doctor. That's why I said there's a lot of gray areas, because then there's like second signatures and things like that. There's like the social worker that says this is my recommendation to the medical doctor, or blah 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 blah. But it's the simplified version is it's a 72-hour hold, which means so there's also like a couple criteria that you have to meet to even be eligible for somebody to sign this document on you.
Okay.
So you can't be like, no, I don't want to be a 1013. No, I'm good.
Yeah. You don't get to play that card.
Yeah, you don't get to play that card. But it's not also something that's just signed willy-nilly. So you have to have a concern that you're either a threat to yourself or a threat to someone else, like an obvious threat. So that could be something that's like a note or something that somebody was left, like if they were suicidal. There has to be some definite some perceived threat to yourself or to someone else. And usually that's a physical threat, somebody that, maybe has issues with like cutting or some kind of self-harm or something like that. If you had like even a really severe eating disorder, like that could kind of fall into that gray area there, especially if you were actually like missing nutrition, depending on what your lab work was looking like. So it is a bit of a gray area, but there has to be some definite perceived threat.
Okay.
The other part is that if there's not a direct or perceived threat, you have to be unfit to care for yourself. So sometimes you get people that fall under 1013s because they're basically in a form of psychosis to where they're not in touch with reality. Sometimes you can even get patients that have really severe dementia that can fall under that category as well, especially if it's not safe for them to be at their facility, even if they're just so confused because of the dementia about where they are, if they're lashing out on other coworkers or not other coworkers, but of their caretakers. If they're lashing out at them and potentially causing harm, the facility could say, hey, we can't manage this person here. And even somebody with dementia could be signed as a 1013. That's, like I said, the 72-hour rule is too simplified.
Yeah, unfortunately, that's the one that kind of comes up that people just think back to.
Right. So during that 72 hours, basically once that document is signed, it will automatically expire 72 hours after it's signed if nothing is done about it in the meantime.
Okay.
So that's where that 72-hour rule comes in, is that once it's signed, something has to be done with that order within 72 hours. Now, that order can be rescinded, meaning like someone's gone in and they've done a full evaluation and things like that. And they say, okay, this threat actually isn't what we thought it was. This person isn't going to hurt themselves or things like that. And that physician can go in and they can rescind that document. The other thing that can happen is if a person actually does need like a placement in a psychiatric facility, but that order is going to expire, a physician might go back in during that time frame while they're waiting for placement if it's getting close to expire and say, I've reevaluated, and they might sign a new one.
Okay.
So that's
you
kind
of
how
multiples if
right.
needed.
Yeah. So you just have to have a new order during that same time period. You can't have like a gap in the order.
Okay.
You can't say, oh, it's 11:09, it's expired, and 11:11, oh, I'm going to resign you. Like, yeah, no, but we're done.
Yeah.
But if it's going to expire at 11:09, we can come in at 11 o'clock and say, okay, this does need to stick, and they can sign a new one.
Gotcha.
So that's what trips people up, I feel like, a lot, is because it's 72 hours, but it's just for that one actual order that was signed.
So it's like getting a prescription on something like, hey, like if you let it lapse and then try to go fill it the next day, you're not going to get it to work if you got to have a whole new one.
Right.
And it takes a while to get that paperwork processed to start it over again if it's expired.
Yes. Yeah.
Ooh, man.
So one word, because I'll go ahead and define this because I almost threw it out there. I was like, wait, I haven't even talked about this yet. So one word is like a crisis stabilization.
Okay.
So crisis stabilization is like if someone were to come in some kind of, we'll say, psychiatric emergency for ease. If someone were to come into some kind of psychiatric emergency and they were to be evaluated like in the emergency department or something like that, that emergency department is not equipped to maintain that person's like psychiatric treatment. So basically what the goal is in the emergency department is to stabilize that person and give them a medical clearance that says, yes, they do not have any medical problems that are going to prevent them from getting psychiatric treatment, to make sure that they are stable to a place that it's safe for themselves and for other staff members. So somebody were to be like really violent or things like that. If someone were to be too intoxicated, you also can't send somebody to a psychiatric facility just because they're too drunk.
Gotcha.
Now, they might have other factors that actually do make them need to go get placement, but they have to be sober enough for all of that to take place.
Okay.
And then, so once that sort of medical clearance is done, you will transfer from like a crisis stabilization phase to some kind of psychiatric facility. And those timelines just vary based off of the patient's needs themselves, like how long you could potentially be at a psychiatric facility. I'd say if you're looking for like an average timeline, an average is maybe around like a week, but it's just dependent because everybody's situation is different. Nobody's the same. Nobody's gonna respond to medications the same. Nobody's home care is the same. Nobody's placement is the same. So that timeline can vary a lot more. So you could still like be at a psychiatric facility for longer, but that 72-hour time period just means that during that timeline, somebody's always reassessing that patient for, do they still meet the criteria to be held legally against their will? Okay.
And they can't sign themselves out during this time period
They
at all.
can't if they're a 1013. Okay. Now, you do have some, those are specifically more for, like we said, people that are a threat to like themselves or someone else. Now, you do have 2013s, and you can have voluntary status as well. So 2013s are typically, it's kind of like a 1013, but it's basically related to some sort of substance use.
Okay.
So these would be people like that they got too drunk at the bar on Saturday and they got in a fight and they needed to come get their head stitched up and nobody was willing to take them home, kind of thing. We can't just let them go out on the street even if they want to leave, so they would be signed to 2013. Once they sobered up, if it was deemed okay, they were literally just drunk. Yeah. Then that 2013 would be rescinded and they'd be sent on their way. The other part of that is if you had somebody maybe that uses meth or something like that, they were in a severe state of psychosis, especially if they were deemed to be a threat to somebody or somebody else, they could be signed to 2013. And then sometimes when you get into the substances, they'll kind of expire. Sometimes that 2013 will stick. Sometimes it'll be rescinded. It just kind of depends on what the underlying rule is that's going along with that substance abuse.
Gotcha.
Like if there's some kind of underlying psychiatric disorder that's going along with it that needs to be treated or could be harmful or something like that.
And that could be something that can be potentially maybe found in previous records or something that's disclosed.
Yeah, or maybe like a family member showed up, you got in touch with someone, or maybe the patient, like even if you're intoxicated, there's like most hospitals have a number where the patient is seen as sober enough to speak for themselves.
Okay.
So once they get below that number, then they'll have them meet with a social worker and everything else, just like if they were a psychiatric workup, and be like, well, what's your home life look like? Like, how much do you drink? Like, what happened? What do you think happened tonight? Is this something for you that happened? So they kind of get more to the root of the problem to see would some inpatient treatment even be helpful. And then they kind of come up for a plan together, and then that social worker will make the recommendation to the doctor on if they think that patient does need to stay 2013, or if they could be rescinded once they're more sober or with a ride or something like that. And you do have some substances that you can't get inpatient treatment for. Like alcohol is one that you can almost always get inpatient treatment for.
Okay.
Because it can be very dangerous to try and detox by yourself.
That's true.
You can have seizures. You can have all kinds of bad things that happen. I mean, even if you have a seizure, then you could hit your head and then you could have a brain bleed. So that's like more like a safety thing. So with that, people can even come like to the emergency department or something like that and sign themselves involuntarily. Like, hey, I want to detox from alcohol. I'm tired of being a drunk for 30 years or whatever. A lot of facilities will not let you just show up for voluntary detox. They want you to kind of go through and get medical clearance from a hospital or something first, because they want to make sure that you are safe to come there, because there's not going to be anybody that's able to monitor you at the psychiatric facility. Like they're not going to be able to monitor your heart rate and your labs and everything else. They also want to make sure that you're not, high on something else, and that's why you want to say it. So that's kind of more like a voluntary status, and that if you were there voluntarily, you could decide like, okay, I do want to leave. Like I
can't do this.
Yeah, I can't do this, or there's too much going on at home, or I don't know how I'm going to pay for this, or whatever your reason may be, or what have you. So if you're on a voluntary status, you can leave at any time. But if you're on a 2013, like maybe you are a known alcoholic for years and your wife or something brought you in because, well, you almost hit somebody on the way home or something like that. That's a little bit more different. Like even if nobody was actually harmed, there was a threat there. So that would probably be something that you can't really sign yourself in voluntarily for, because the risk is too much there. Well, what would happen if we let him go?
True. That's true. That's always good at times as well, whenever another person can be able to see it, to be able to turn that in as well, to be able to have that little gap as well. So you can't just, I'm just going to sign myself in, sign myself out, because some people are not going to want to sign themselves in entirely as well.
Well, and the other part is once you sign yourself in too, once you start getting medications for detox, even at the emergency department, you're now under like substances, because they give you things like benzodiazepines and things like that to help prevent you from developing seizures as you come off of the alcohol. So then if you're like, I'm out of here, well, you can't just go get in the car and drive, because now you're high on the drugs that we gave you.
Yeah. You can't just go, hey, I'm going to stop taking this medication.
Right. So then you also have to have like somebody that's willing to come or things like that. So there's a lot of factors that go into it. So there's also always a potential that like somebody that was voluntarily, if that first scenario were to come come up and they were seen as like a threat, I could see it potentially being turned into a 2013 as well. Sometimes that happens even by choice, because sometimes it's easier for that person to get placement at a facility by being a 2013 than being a voluntary, just depending on like, especially like, insurance rules the world.
Yeah, it does.
But I have seen patients that have come in for voluntary status and then like also like in agreement, but like were signed into a 2013 because they couldn't pay for treatment themselves. And with a signed 2013, the state has to place that patient somewhere, regardless of if they can pay or not.
Gotcha. Which is thankfully they can be able to do that for some of these places, because there's so many people that do need help that cannot afford it.
Yeah.
And that's a huge, in the medical world, that I have constantly hear about, is there's that cannot afford care but need the same care.
Well, and it's crazy too, because sometimes even with insurance, you can't afford it.
No, that's a true statement. I've seen plenty of medications that I've seen my family have to pay for, and you're like, how in the world can you pay for this one piece of medication? And how can they charge this much for a piece of medication that you only get a month's dosage of, and that may cost you your whole entire paycheck for the month just to be able to do it. And you have to make that call of, what do I need this month? Do I need this medication, or do I need to eat? And having to make those sacrifices and seeing families make those decisions is so hard.
Yeah, it's frustrating enough to see it for people that don't have insurance and to like try to help them navigate and things like that. But it frustrates me 10 times fold when I see somebody that has insurance that's also going through those same things, or it would be easier for them to get the treatment or medication they need if they didn't have insurance.
And that's the part that's scary right there. Whenever it's easier to not have something to be able to make it. I mean, insurance, that could be a whole nother.
We could do a whole podcast on insurance.
Maybe one day we'll have a thing on insurance, because that, oh my gosh, that's a nightmare. The United States and other countries around the world are just as bad too.
Yeah, so those are the big ones that I know that I'm going to bring up. The other one that I do want to make sure I throw in here is EMTALA.
EMTALA? Okay.
So this is a law. It's called the Emergency Medical Treatment and Active Labor Act. It's in the United States. Okay. Every state. Doesn't matter what state you live in.
EMTALA.
Yeah.
Okay.
So it's a national law that says anyone who walks into an emergency department, regardless of their ability to pay, has the right to a medical screening if they request one, or if a request is made on their behalf, like by a police officer or something, or by like a parent. It has to be like some kind of custody.
It cannot be the doctor themselves
that's requesting the
screening.
No, but really by that point, like by the time the doctors, like by the time you already come into the emergency department, like when you're checking in, you haven't even seen a doctor yet.
No, that's true.
So even like from a nursing perspective, like I can't have you tell me that you want to be seen in the emergency department. So even if that police officer that's standing next to you says, hey, this person needs to be seen in the emergency department, we brought him in for an evaluation. If you are still telling me no, that you don't want to be seen, and you seem coherent and the situation sounds coherent and things like that, technically that could still be seen as a refusal, like for you to refuse that you didn't want to be seen.
Okay.
So sometimes that can run into some gray areas. Obviously, if you're intoxicated or you're like if you're actually in custody, it doesn't matter if you refuse or not. But if you're not in custody, right. So but if you're not in custody and they're just like bringing you as a courtesy, you have the right to refuse because you're not in custody. Does that make sense?
That does.
Yeah.
That does make sense.
Yeah, let me clarify that part. Yeah. So like if you're in custody, that police officer can say, hey, this person's here for a medical screening. It doesn't matter if you refuse or not. No, it doesn't mean you have to be cooperative.
That's another true
statement. That's a whole different thing.
You see a lot of that one, the combativeness.
Right. But basically, it's a law that protects anybody from being screened. Now, all that screening does is mean that you're going to be seen by a provider, which could be a doctor, it could be a nurse practitioner, it could be a physician's assistant. It does have to be somebody with an advanced degree. Okay. So it has to be one of those three. It can't just count as a nurse or an LPN or something like that. Okay. It has to be an advanced degree, but they're going to assess you and say, does this person need any kind of immediate life stabilizing care?
Okay.
That's what you're entitled to regardless. Now, you're not necessarily entitled to the care if it's not life-saving. Sure. That then you do have to pay for, or you get billed for, or anything like that. But the actual screening for somebody to say, hey, look at me, this is what's going on, that you're entitled to regardless of if you can pay.
Well, that's good, just to already know what's kind of going on.
Yeah.
It's easier to be diagnosed to know where you need to go to next rather than just showing them. So like, hey, I need X, Y, and Z, but like, do you need it?
Right, exactly. It's like if you like walk in, you're like, oh, I have chest pain. And they're not going to be like, oh, well, can you pay? Like, we're going to treat you and make sure that your chest pain and stuff is fine. And then if you're not actively having a heart attack, then we'll go, okay, well, this is what we think you should do. This is the workup. Because by that point, you've been screened and you've been considered stable to continue the workup. So the same thing happens with mental health stuff too. Like if you come in and you're like, hey, I'm suicidal, like no, but the last thing anybody's going to do, well, hopefully the last thing, could be down at the bottom of the list is people are going to be like, do you have insurance to file? And that's mostly because if you come in and you say I'm suicidal, like the emergency department's not going to be able to treat you. Like they're going to get you started, but they're going to have to transfer you to a higher level of care, which would be a psychiatric facility.
Yeah. Bless anyone that has to walk in and say, hey, I need help. I'm suicidal or have this. That takes a lot of nerve and it takes a lot of like trust in yourself to be able to trust in others as well. So you're an amazing individual if you could be able to step up and say that about yourself, to be able to take care of you because there's only one of you.
Yeah.
You were all loved. Remember that. You were all loved.
Yeah. It's a big deal. It's not an easy thing to do.
No, it's not.
And it's also not an easy thing to just come to terms with, like even being able to label yourself that. And then when you put yourself out there and you go and you feel like you're getting treatment, well, now you're allowing other people to label you as that too.
And that's hard to have the eye on you and feel like you start in your mind, start judgmental on yourself as well.
So it's like you said, you're like, you have to take care of you first, which means that you don't have to be able to fix that diagnosis. It's not your job as a patient.
True. Yeah.
But you do have to be willing to
admit you have the problem.
Right. And accept that and then go in and then get treatment. Because if you don't do that, everything's going to be 1,000 times harder. And I don't mean like even from the healthcare perspective, just like you as an individual and like coming out of that and the steps that you need to take and everything else. If you're not willing to come to terms with your own diagnosis, whatever it is, it's going to be a lot harder to be able to get to a point where you feel comfortable like living with yourself.
It's true. That's the thing. It's willingness to accept help, willingness to take the actions to be proactive in your own health to make that, wanting to make that change.
Yeah.
You have to be willing to be a part of that. And that is a lot. Now, you've said that you've been 8 years now working in the medical field here.
Yeah.
And did you ever imagine that some of these struggles that you would face when trying to navigate this medical field that you have loved and worked in for so long?
I don't even know how to answer that because it's so far, like the answer is absolutely not, right?
Yeah. Same with
but
teaching all the time.
It's so much more than that. It's like literally like never in a million years would I have ever thought that with everything that I knew and with like how much I was just working with patients that had mental illnesses and things like that, just doing the crisis stabilization part in my emergency department alone, how much I knew from there and how much I knew about the processes and, okay, well, you don't need inpatient or you don't need outpatient. You need this or you need that. And how hard it is to navigate, much less without throwing insurance into the work, but just on an individual basis and things like that. I can't even imagine.
Yeah. I mean, and then things changing so frequently too within those systems and in those rules.
Yeah. Because, I mean, you think like, oh, yeah, I have all this experience and I have all these things and things like that. And then it's just like, I mean, if you were to have to teach somebody something, you pull back on those skills that you learned.
Yeah.
And how to do this and what kind of learner you are and things like that. So it's the same thing in the medical field. You're like, you pull back on like your assessment skills and like, how do you talk to people? How do you deal with delusions, things like that? How do you de-escalate arguments before they get worse?
Mm-hmm.
And so you pull those skills out from here and then like with paranoia and perspectives and things like that and having all those toolbox and still none of them working.
Yeah.
That's
hard.
That is hard. I could tell you more stories than we have time for, but
gosh, I can imagine.
Yeah.
8 years worth of it. Same with an education. And gosh, I'm going on I graduated in 2011, started working in 2012. 12 years, you start building on these. I like to call them war stories.
Yes. Yeah. So you take up all that experience, right? When you're in the field, so to speak, and then you turn around and you try to apply that to your personal life. And you get very much into this, just trust the process because you know that you did a good job, right? You know that you did your best for all those people.
Yep.
They might not have all had 100% like ideal scenarios, but you know every day you showed up, you did the best that you could for that person based off their situation.
Yep.
So you put 100% faith that that's all going to be returned and that it's all just going to go as well as it's supposed to. Yeah. Trust the process.
Yep. Not always.
I learned on the family side of things, you don't get to trust the process. On the caretaker side of things, you don't get to trust the process. And that's hard because seeing from both perspectives, as a nurse, I know how many times I sat there and I listened to family members and things like that, and it just sounded like off the wall, or it maybe wasn't taken as seriously enough, or it's like, okay, yeah, that's what they said, or something like that. But it didn't seem as weighted as it did when I was reversed. And I was the one that was then like assuming that he was going to say what he was supposed to say. I was assuming that anybody that talked to him, my husband, anybody that talked to him, that they were going to see what we had been dealing with, because it wasn't like it was just a phone call and send him to the emergency department. Mm-hmm. It was months of medication management, of trying to convince him to go on his own, working with doctors, having him see psychiatrists, trying to get him into counseling, and just what we were dealing with at home and all kinds of things before we ever even made it to the first emergency department.
So what does that kind of take in order to get you said you've gone through all the different medications, all different psychiatric stuff. What does it really like kind of take in order to get to that stabilization of getting to that 1013 or that 2013 for you?
So there are easy ways to do it, and there are not easy ways to do it.
Yeah. Fair play.
So I will also preface that, especially after living with my husband, that not every person is going to benefit from being a 1013 or 2013. Okay. You see that in healthcare. Counselors know that. That's why sometimes it's actually a little bit harder to place somebody because, based off of a person's history, like if somebody's been incarcerated or something like that, they're not going to do well with going to an inpatient psychiatric facility if we can avoid it, because they're then going to also feel like they're incarcerated.
Oh my gosh, yes, that connection back, the PTSD, as I'm going to call it, back of the traumaticness that may have happened inside a jail or somewhere else.
Right. So then that environment for them is already not therapeutic.
Yeah.
Obviously, there's sometimes, like, if you're truly a threat to yourself, it can't be avoided. Like, you got to go. But you also hit the point where it's like, if there's anything else we can do for this person in the meantime, whether it's like extensive outpatient therapy or anything like that, those are the avenues that we need to try to go first.
Okay.
So it also kind of depends on what's going on with the person. Because there are obvious, like we said, kind of back to the 1013 thing, like there are obvious direct threats, and then there's like all of these gray areas. So hopefully somebody's willing to go, right? You're willing to love this person into treatment practically, and they're willing to see it themselves or able to see it themselves, because sometimes they might be willing to, but they might not be able to.
Looking on the mental illness sides, you can't always see what's going on, because that's part of the mental aspect there that you're trying to, the delusion that may be there.
Right. So there's that part of it, hopefully, is that you can just convince this person to come, which that did happen for my husband a couple of times. He did willingly go on his own. So they did not sign him because he was there willingly, basically for this stabilization part. Again, kind of like, what are we going to do for this person?
Yeah, how can we make this life better?
Right. So there wasn't like an immediate need to sign him. It was more kind of, well, we're going to work you up and then go from there. But he got so freaked out 15 minutes into the workup that he walked out, and there wasn't any need to stop him at that point because there wasn't enough information that had come up.
Gotcha.
So obviously that was kind of, well, not obviously, but that was kind of during COVID too.
Oh, and so there were stresses on the department at that
right.
point.
Well, and then there's also like restrictions on, like, there was restrictions on family being in and things like that. And so even though like one of the emergency departments we took him to, I even worked at, but I didn't want to pull special privileges because I worked there. So True. I sent him in just like I would, my mom or anybody else. And he got mad and he walked out.
Which is unfortunate to kind of see on, because of living in a household and seeing that in family things of what may be perceived at one moment, 5 minutes later cannot be the same.
Right.
You never know what that can kind of be able to face. And especially when you're already unstable at that point as well. And what you may have someone convinced you with at that point, in your mind, internal voices could change that. And
until that legal document is signed, you still have a right to walk out of that emergency department.
So sign on that dotted line.
Yeah. Until somebody actually comes running down the hallway with it that says, this is for you, I have assessed you.
Yeah.
You can still leave. Now, that doesn't mean that it's going to go well.
True. But
especially if there's enough people that really feel like you need to be there.
Yeah.
But technically, until it's signed, you can leave. And so because he was never a direct threat to himself, his was always. So my husband has schizoaffective disorder.
Okay.
Which was not what he was diagnosed with originally. Originally, it was bipolar disorder.
Yeah, familiar with bipolar disorder.
Yeah, so
familiar with that one. 1 and 2.
Yeah. So it's a lot, right?
Yeah, it's a lot.
So basically, from bipolar disorder, if you're having like especially hallucinations and paranoia with bipolar disorder, you kind of sit in this gray area with bipolar disorder before you kind of get like upgraded to the next diagnosis.
Yes, and it also depends on the length of your mania.
Right,
the
exactly.
depression.
Yeah. Right, all of that. Yeah, it's really complicated diagnosis.
Yeah, it is.
And so he was almost cycling too fast through his highs and his lows to really be bipolar.
Yeah.
So typically with like bipolar disorder, which you've probably experienced, it sounds like, is that you kind of have these like gradual peaks and these gradual valleys.
And it could last for 7 days, 10 days.
Right.
And you could be in that really low for a long period of time.
So he would go where he could literally, I don't want to say he could be up and down on the same day because I don't think I ever actually saw that. But within 2 days, he could be cycling.
Be that quick.
Yeah, he could be that quick. And so there are other diagnoses that fall under that too, but you also have to show this pattern of behavior for so long before anybody kind of really labels it that.
Mm-hmm.
So they just kind of do the treatment the same while we kind of figure out your diagnosis.
Ooh, that's not the best of options at times.
It's not.
It's not, because you cannot put 2 peas in the pod that are totally like potatoes and then sweet potatoes. They may look the same.
They're both potatoes, but they are not the same potato.
Not the same potato.
And you kind of get on this like spectrum, right? Because everything's on a spectrum nowadays.
Yes.
But you kind of get on the spectrum between bipolar disorder and like schizophrenia because your cycling is also because of your hallucinations and everything else like that. And then so schizoaffective disorder kind of falls in the middle. So it's kind of like you've basically had uncontrolled bipolar disorder for so long, but you're not really schizophrenic. So you're kind of like sandwiched in between the two. So you kind of have like some symptoms of one and some symptoms of the other. Now, that's not like an official medical diagnosis. That's basically just how it was generally explained to us when he got the upgrade.
Yeah.
So to speak.
I don't know if that's the best upgrade to get.
I'm sure there are a lot better upgrades to get, actually.
This is not like you're going from platinum to, something else. Yeah.
No, but everybody's like, so it's not one, everybody's heard of like schizophrenic and bipolar disorder, but like it's not really either one, which makes it hard to treat as well, because you can kind of look like one and you can kind of look stable and you can kind of look like the other one and you can kind of look stable.
The medication that you mix between the two may be effective in some ways and then not for others.
The dosage is different, the combination's different, all that stuff. Yeah, so
it is so drastically
getting
different.
A doctor that can, which honestly with that one, it takes time. Time is the main qualifier, but getting a doctor that can truly like nail down what your diagnosis is, regardless of what you have going on, is like the first key, because that we didn't get from him. Gosh, I think we were on like almost year 2 of trying to get him stabilized, outpatient stabilized. Yeah. Meaning like he was stable enough to be home and like be out in the world and things like that. But he was not stable enough to consistently like hold employment, interactions with family members and things like that were always off. Like, we were hearing voices in the house, not we, because I was not part of it, but he was hearing voices in the house.
But you're hearing through him of like, hey, I'm hearing this. And so you start having to listen, trying to figure out, okay, is this a hallucination? Is this what's kind of going on?
And that's one of the things that was so hard at the beginning too, because his symptoms started so gradually.
Yeah.
And they started when I was always at work, and they always started at night. He would say, He used to do a lot of music recording. He doesn't do as much now, but he used to do a lot of like rap music recording and things like that.
Cool.
So he would say that he was in the basement and he heard the neighbors through his microphone in his ear. And they were like talking about him and things like that. And it's like, what? I mean, our houses were close, but it was like, but it was also like, I mean, maybe. And so I would start to say things
you never
like,
know, yeah,
I'd be like, oh, you should record it next time. And he was like, oh, I didn't have it hooked up. I couldn't record it. And so it would be little things like that would come up. Or he'd be like outside and he'd swear he heard them. But then I'd walk outside and nobody would be there.
Yeah.
And it was these one neighbors in particular that it all started with, which we were having problems with. So again, it was like, well, maybe, but like, it was hard to say.
It's true. You never can tell on what someone may have better hearing than you. I've got terrible hearing. My wife is like, she can hear something. Do you not hear that? No, like, I guess not. Okay.
Yeah.
But but you never can tell someone's processing it.
You can't tell, right?
Really
like
hard.
I didn't agree with it, but I also didn't have enough evidence from my point of view to deny that he couldn't do it.
Yeah.
So that started, and it stayed that way for like a month or so. And it was always hard because it never happened when I was at home.
True.
It was always when I was gone. So then how are you going to prove it too? things just kind of kept escalating, things like that. It started to get more advanced. And then we started to deal with, he thought that there were people that were like coming into the house and like bugging things and things like that. And that's when it was like, for me, when it was like, okay, we're starting to.
There's a different level here. Something's not exactly right that I can now pick up.
Nobody's coming into the house and putting bugs in the wall and painting back over it with the exact tape that paint that we have on the wall. So that's when it was like, okay, this is kind of far-fetched. And everything just really kind of started slowly growing from there. We tried to do some things to try and decrease some of that paranoia and everything else. Like, they actually make these little like debugger things that you can buy on Amazon.
You can buy, exactly. You could be able to scan a room.
Yeah, you can scan a room.
That's really neat.
If you know how it works. I had no idea how it works.
I've used one at one point when I was with a friend, and they're like, hey, that's, we're going to an Airbnb. And we walked in, they pull it out and start looking. I'm like, what are you doing? And they're like, oh yeah, look at this app. I'm like, that's really cool. But my brain would, I can't do Ring cameras and things like that. I like the idea of it, but it's, for me, I would get so paranoid wanting to look at it all the time or wanting to like constantly pull it out in places.
I couldn't even figure out how to work the thing. It was like this whole like dial and thing, and you were supposed to like wave it, and if it did this beep, and I'm like, it all sounds the same. So anyways, but they do make them. So, but I would buy things like that because I thought that would make him feel better.
It would help, the alleviate, just one less stressor.
Yeah, it did not.
It's sometimes those, whenever you think you're de-escalating, you're actually increasing something else.
Yeah, exactly.
Yeah, I ran into that a lot growing up, of seeing these little things that we thought was going to work, and then all of a sudden it didn't. And then it made the situation maybe a little worse.
Yeah. So then some of those things started happening, and it was like, okay, honey, like we're not okay.
Yeah.
So he let me. One time he went to the emergency department on his own. Like I said, he walked out. He actually took an ambulance, and they asked him where he wanted to go, and he just told him the closest. And I was like, why did you tell him that? But the closest one at that time was not where you should have been going.
Not the best place to be.
But I ended up having to go pick him up, and he actually stayed for the whole evaluation there the first time. Well, that's what he told me. We started getting like medical records and things later to try and get like disability for him, which didn't work. But
that's a long route.
Yeah, it's a long route. It's really hard with mental health. It's so hard with mental health.
I've definitely seen two sides of where it's been accepted within a year, and I've seen it sides where it's taken 5 years.
Yeah.
To be able to get it.
Yeah, once I started reading the notes on that note, he walked out, and he didn't tell me that he walked out. He told me that they had let him go. So I took his word for that, right?
Yeah.
And then let's see, another one I drove him to. And it was another, like things get bad, right? Especially at the beginning when you're trying to get things stabilized and things like that. They can get rough.
Oh, yeah.
And so I'd actually had a patient who had like recently been diagnosed with like a brain tumor. And he said the only reason why they figured it out was because he'd have personality changes. And I was like, huh. And so I brought that up to him.
Your brain goes, wait a second.
Yeah, I was like, maybe you have a tumor, right? That's something that's like, I don't want to say easy to fix, but easier to fix.
Easier to kind of diagnose, to pinpoint, to see, hey, what can we do to alleviate?
Yeah, something that has a known cause, right? Because that's the easiest thing in theory. And so he actually made up a song that he would sing around the house to annoy me, but
as a
he did not have a tumor. But he got his little CAT scan for that, and he walked out after they did the CAT scan. We didn't even get the results till later, but he walked out after they did the CAT scan because his thing that he used to use to push me would be to ask for a divorce because he knew that I wouldn't do it.
Yeah.
And he felt like, from his perspective, he was trying to do it so that he could free me of what he was going through.
Yeah, we don't want to, I can say as myself, of having some of my issues, is you don't want to put that on someone else. You want to have them to feel safe and feel comfortable. But as you know, as a spouse, when you love an individual, you want to be there for them. And this is just their way of trying to do something for you, that they're trying to help. They think they're helping, but really in honesty.
Yeah. And he didn't have any of these issues before we got married. Yeah. He was like, we used to work together, like none of this. So he got Bell's palsy on our honeymoon.
Oh, wow.
And for most people, so that's basically what Bell's palsy is it makes you look like that you had a stroke. Now, it's not any stroke symptoms, but it's all on the face. Yeah, it basically causes facial paralysis on part of the face. For most people, it resolves. For like 10% of the population or something, it doesn't. And a lot of people have some kind of varying of residuals, but about 10% of the population, it won't resolve for, and they don't know why. Yeah. So we were on our honeymoon in Jamaica, no healthcare.
Yeah, not there. Yeah.
So he had me. I was his healthcare.
Yeah,
And
hey, it's
so
better than none.
yeah, like we got off the plane and he was like, "Oh, my tongue is numb and tingly," and I was like, "What?" And I was like, maybe
Did
you're
you
just
eat
not used to
something?
right.
Yeah.
I was like, well, maybe
Yeah.
you're not used to the change in the air pressure because he'd never flown before, everything else like that.
True.
And he'd experienced tingling and stuff in his hand, like when we'd gone to the beach one time before. So I was like, maybe it's like an air pressure thing with you. Like that wasn't too abnormal.
Could be. Yeah.
So we went to dinner. It was fine. But we woke up in the morning. He was like, and he like half of his tongue was numb, everything else. And like it almost looked first like he had like an allergic reaction, like because he looked so puffy on that side.
Yeah.
And so they had like a nurse there at the resort or whatever, and we go see her, and she just said, "Oh, well, it's $600 just to call the doctor out." And we're like newlyweds. We're like, $600 just to call the doctor?
Yeah, where's it going to be when they get here?
Right,
Yeah.
exactly. And I was like, okay. And I was like, we're going to go to the gift shop first, and we're going to get you some Benadryl and see if this is like
works.
allergy.
Yeah.
Right, like just calm
Smart
everything
one.
down.
Benadryl. Oh, Benadryl
fixes everything.
Yeah.
Can't sleep, take Benadryl. Itchy,
Yep.
take Benadryl. Yeah,
Yep.
it's a magical drug.
It is. Just don't take too much of it.
Yeah, exactly. Is that also will get you into trouble? And so we like tried to treat it and things like that, kept going back to the nurse. Finally, once it was like, okay, it's not getting any better, it was like, we're going to be here for another day. We might as well just, well, for us, it was like, we might as well just wait till we get home at this point. Like it had already been 3 days and it wasn't getting any worse.
Yeah.
So we went home, we went to urgent care, and that's when they were like, oh yeah, it's Bell's palsy. And so because they did steroids and things like that, but Bell's palsy treatment is tricky because you have to get it within a certain amount of time frame. And like it's not really anything that's really well researched because it's not considered like a deadly diagnosis. Like for most people, it resolves or your face is a little crooked. So there's not like a lot of research that goes into it and things like that. There's even like controversial, like there's disagreements among the medical field, like if you should give antivirals or not. Pretty much everybody gives steroids, like high dose steroids and things like that. But there's disagreements on like
what's the effectiveness of this?
Right, like what's the therapeutic dosage? Right, when do you have to start it by? So, because it's just not something that's researched.
Yeah, it's not a very common researched in effective. Like this is what the answer is.
Right, because worst case scenario for you in the medical world, worst case scenario for you, like it doesn't resolve and you're fine and you keep living. So it's not considered like, a deadly diagnosis.
Yeah.
But for us, it was life changing because his did not resolve. And so
that affects you mentally, physically.
Yeah, because you can't smile. His eyes, he has like a lazy eye now, so to speak. He calls it his good eye.
I love that. I love the humor.
Yeah, he calls it his good eye. He's like, it's my good side. But he can't fully smile on that side. Like even things like eating, he can't whistle anymore. Things like eating, and all that changed for him.
Yeah.
Just because of this inflammatory nerve.
Yeah.
And it's usually caused by like a virus or something. Like it's just, nobody knows which virus. Nobody knows, like there's, we've seen a lot of specialists just for that part alone.
Interesting.
And everybody's just kind of like, you just get it. You just wake up one day and you get it.
Right. Yeah, okay. Yeah, like if I sit down on a toilet seat, is this what's happening? Exactly. Sounds like COVID. It could happen. You could get it by this, you could get it by that.
Yeah, exactly.
That's a whole another world in itself.
Yeah. So after months of waking up every day and you look at yourself and you're like, I look like this monster. He was 27, 28 years old, something like that. And waking up every day looking like you're a 40, 50-year-old man because you look like you had a stroke. Like that does a lot to your mental health right on its own.
Yep.
So all of his stuff really kind of started. Yeah. It all started really as just like anxiety and depression and things like that. And then we're newlyweds. And then like we had this terrible honeymoon and blah, 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 blah. And we treated it as anxiety and depression to begin with. And we were both kind of dealing with things at that time in regards to that because he didn't want to take pictures. And here it's like, I want to show off my new husband because I think he's the greatest.
Yeah.
And we had like a couple of years of our life where we don't have any pictures together because he hated every picture that he looked at.
Yeah.
And then eventually, I think just looking at himself so negatively for so long, like he stopped working because of that, because he always felt like that the stress made
people are looking at him.
Yeah, exactly. Exactly. 100%. Even like going to the store was a huge ordeal for him. Going to the grocery store and going grocery shopping together, he hated it. He would get so anxious in the store, he'd have to leave because he felt like everybody was looking at him and looking at his facial paralysis.
Yeah, something that always bothers me. It's a weird little pet peeve kind of deal is whenever I walk into a store and someone stops and they stare at you, as a child, I understand the curiosity that comes to the year 3, 4, 5 years old. There's a curiosity.
Yeah.
But when you're 20, 30 years old, 40, staring at an individual, if you're curious to that point, come talk to me.
Yeah.
Let's go to me. Don't just stare at me, because then now I'm getting self-conscious. You become the teenage girl that's in middle school or high school and go like, oh my gosh, why are they staring at me? Like it's rude to a point for that as well.
And it was so mind-blowing to me, because I was like, what are you talking about, honey? Like I couldn't even fathom it, because I'm kind of like you. I'm going and
I'm not gonna go.
I don't even know who's walking by me in the grocery store.
Same here. Like I'm doing.
What do you mean they're just looking at you?
A, B, C. I'm in, I'm out. Let's go.
Yeah. I'm like, I just need you to come help me, And so,
but you start thinking about it because you've seen it before, and that's self-conscious is so hard.
So he felt like everybody was staring at him. He stopped going to family events and things like that too, because he thought my family was looking at him. Like, and then he started, because he was so self-conscious about it. That's one thing that kind of started to lead to the paranoia, because then he started thinking that he was hearing people talk about him.
Yeah.
And that was one of the things that was hard to pick up on at first too, because we would be like in the store or whatever, and he would be like, did you hear what that person just said? And I'm like, huh? No. But I couldn't tell if it was because I was oblivious to what they had actually said, or if it was because they didn't say anything.
True. You never know.
So it's just kind of one of those things. So like going back to your other question, like we were totally blindsided, because even the first part of our relationship was relatively normal.
Yeah. And that's same with my wife. When we first started dating, it was like, oh yeah, the happy-go-lucky stuff. And then all my stuff started taking place, and it completely changed the whole dynamic of my relationship with her. And, thank God, I love my wife to death and what she's been able to handle around with and deal with. But you're just like, these are two different worlds now.
Yeah.
That's there.
Yeah.
That you're looking at. And here we are in, thank you for being a loving spouse and dealing with that as well. And I look at other people in my family and friends that if you can stick with an individual who you know what they're kind of going through and what you're dealing for, and being that supportive individual because you know who they are as a person, you hats off, applaud, you deserve the mugs that say world's best wife and things like that, and awards beyond all belief, because of some people can say it, some people cannot. I'm going to say for me, thank you for all you people that do that. Because there's some days where I can be able to acknowledge that and say it. There's some days that I cannot be able to see it physically, understand it. But when I look back on some of the things that my wife went through, I go, you don't think about it in that moment. Because for you, the person that's struggling with the mental issues, you don't see that. But then later when you look back and you go, how did I get through this? Well, honey, I did X, Y, and Z. Wait, what?
Yeah. I tell him
you.
stories sometimes, and he does not remember them at all.
Yeah, it's true. But
it goes both ways, because then he'll tell me useless information, and I'm like, what are you? He's like, yeah, it happened 3 weeks ago. He's like, anything related to fishing, I remember. And I'm like, of course you do.
We all have our little stuff that's there, and then we get on to. I'm gonna jump kind of direction with, you may have the positive sides of the interactions with yourself that you can be able to recognize this, of when your husband's saying, hey, I want a divorce, I want to kind of step away from this.
Yeah.
Is then you run to the side of when someone you don't know, say for a police or somebody gets involved here that's outside of the realm, that can create a whole stigma within itself that travels with you.
Yeah.
That's why I love seeing stickers now in cars where it's hey, I may be unresponsive, may have this or XYZ. It does not mean that I'm angry or frustrated with you, which I can see people taking advantage of that also in a negative way.
Yep.
But you got to have that combat training to understand, hey, this is what this could be and that could be, and the consequences that travel with you if all of a sudden you get pulled over and you're having a manic moment.
Yeah.
And have you ever noticed any of that's kind of, or allegations or crimes that has changed the process in life for y'all?
Yes. So I'm going to answer that question. I'm also going to backtrack a little bit, because
go for it.
We talked about walking into the hospital to sign in and commit, or not commit, but to sign in as I need help, or your family member goes. But the other two ways to go, you have to get another family member, or it doesn't have to be family member, but you have to get somebody else who has said, yes, I've seen this person within the last 48 hours.
Okay.
And you two can go to, I think it's probate court together, and you can basically sign, I forget what the form is, but you basically sign a document in front of the judge that says this person needs to essentially be picked up to be taken to the hospital.
Warrant kind of in a way?
It's kind of a warrant, yeah. It's not as permanent, because it's more just for that person to be picked up, to go for an evaluation. It's like an obligation for that person to be evaluated in emergency department.
Okay.
Now, it doesn't mean that once they get to the emergency department or wherever, that physician is still going to say, yes, they are 1013 or 2013.
So they can be rejected.
Yeah, they could be rejected. But that document gives police the right to go and apprehend that person with basically it's like a warrant to go get an evaluation.
Okay.
And they can apprehend that person and take them to the hospital, and then that person can have to undergo the evaluation part for stabilization. Now, they could be deemed medically competent and like not needing any kind of crisis stabilization or anything like that.
Okay.
So that's kind of like...
Or that could have been a good day for them. We're really not
Right,
honestly,
exactly.
they
That's
picked
what I
up
was
on the
about
wrong-
to say.
That's the
Yeah.
challenge because
Yeah.
you can have a good days and bad days.
Right. So you guys could have gone up there and seen them and had that signed on a bad day for that person, and it could have taken however long for that person to get picked up. I think they do have like within 7 days or something they have to be apprehended. But then when they go to the emergency department, they could be completely fine.
Yep.
And I've seen that before on a professional level as well, which is super frustrating. But
Yeah,
the
I
other
can
part of
believe
that
that.
is too, if you don't have like if you're whoever your person is like that you're caring for as a caretaker, if they don't have a good support system or they're not willing to have people around or be open about their diagnosis or anything like that, like if you don't have two people, you can't get that signed.
True.
And that's a problem that we ran into because my husband didn't really talk to anybody when he was going through his stuff. It was like me because I was there.
Yeah, because he was becoming more reclusive because the fact of the fear, the paranoia that comes in and being judged and being heard.
Yeah, especially, and then like he has some family members that he talks to semi-regularly, but he has a lot that he doesn't just because that's how his family works.
Yeah.
So then to also have somebody that could recognize that difference in his behavior and adjust his behavior change and things like that, if they're not very involved, it can be really challenging. And he wasn't working then, so he didn't really have like a whole lot of friends that he interacted with that were seeing him like that. So that can be the challenging part with that. And then if there is an obvious threat to a person, like the individual or, someone else, then if it's an obvious direct threat, police can take them into custody. There's a whole lot of gray area on that, which I did not know, which a lot of physicians, like his physician that he was seeing at the time, which thank God we fired him.
There's good and there's bad for everything.
There's good, there's bad for everybody.
I went through several before I found a good diagnosis and good medication and stuff. Ooh, and that's a whole nother world, medications.
Yeah, yeah. So he literally said, have the police take him. So I don't know how many times we had called police already, like just because of what was going on with the situation in the house.
Yeah.
Things would go missing. He swore that if I didn't call him to help them come look, then I was in on it, and that's the neighbor had the keys or something just outrageous like that.
Gotcha.
And the police came and they searched the house and they couldn't find the keys either. Meanwhile, the vehicle's sitting in the driveway, so obviously nobody stole it.
Nobody stole it, yeah. It's just sitting there.
It's sitting there.
But
yeah, he had
the fear. That comes into play.
It ended up being in some random place, like in a drawer, in the back of a drawer behind it, like in the bathroom or something, like someplace that nobody would have ever looked. And he put them there, but he had no recollection of putting them.
Yeah, exactly.
And so it took situations like that, and they would come and they would see it, and then they'd kind of throw their hands up and be like, sorry, they can't do anything. There was one night he poured paint everywhere, like all over the bed, all over my clothes, everything else like that. And he got mad about something. I don't even remember what he was mad about now.
You never can tell. I was saying you never can.
He was mad about something, and just we were painting the house, and he threw a can of paint everywhere. The police came because at that point, that night I was mad, and I was trying to report him for like property damages for personal property because some of it was like heirlooms and things like that.
Yeah. And there's blinders on at that point for them. Whenever
because it's so much rage. There's so many emotions on both sides.
You can't physically understand kind of what's happening.
Yeah, and so they came and they made it up, but there's nothing we can do. Like he lives here. Like it's mutual property.
Yeah.
Yeah, and then they left, and there was a time that he was like kept switching the car from like neutral to drive or whatever when we were driving. I don't know, somehow like 911 ended up getting called, and he like jumped out of the car and was like running down the street, and they're like, well, he kicked his shoes off, but like there's nothing we can do. Like he's not running into traffic, he's just running down the sidewalk. Like it's weird to run without shoes on, but like it's not a crime kind of thing. And then so it takes a lot, and then I even asked them one time because I said, listen, like, so what you're telling me, what I'm understanding is that basically, because we would get in really bad arguments and we would get in each other's faces. We wouldn't put hands on each other.
But you still, like, you're verbalizing, hey, this is
very
what I'm feeling,
verbal.
this is what I've got going on.
Yeah, holes in the wall.
To get them to understand as well.
I mean, he used to love to put holes in the wall just because that's where he would displace his anger at.
And hey, better there than on a person.
Yeah. And so, I mean, they'd come when they'd search for things and they would see that. but there was no evidence that he was physically harmful to himself or to me.
Yeah.
So basically it took one night of him kind of pushing me out of the way, like when he was walking down the hallway, for me to be able to be like, oh, he pushed me. Okay, now I can call. Like, I felt like, oh, this is my moment. Like,
this is something
he's finally going to get the help that he needs. Yeah, because he's pushing me down the way, out of the way. Like, no, I wasn't injured. I'm fine. I'm fine. I'm fine. He just needs to get taken to the hospital.
Yeah.
That's what I kept telling them from the moment that they walked up. And they were just there like the day before or 2 days before with the pain incident. And I think the pain incident happened because of like something being bugged or something. And the argument happened because he wanted me to wake up at 3 o'clock in the morning and help him like debug the house. And I was like, no, I'm sleeping. Like, I'm not, it's fine. And so that's how the argument started. And of course, you know, nobody should get in arguments at 3 o'clock in the morning regardless.
No, that's a true statement.
And so they came, and basically by that point, because they had been contacted so many times with all of his psychosis issues, the things being missing, and then now there's this argument where actual physical contact has happened regardless of injury, they could finally say, okay, now he can be considered a threat, and we can take him into custody, and we can take him to the hospital for evaluation. But that was after like at least the 5th time of having to call police, if not more.
Wow.
And because at that point, there was no way to get him to go. And I would make these calls to his psychiatrist, and I would let him know like what's going on and things like that. And the psychiatrist would just say, just have police break him up. And then that night, what they came to, I was trying to get him to take his medication. We also got in a fight about that too, after he tried to help me debug the house.
Yeah.
And he flushed all the pills in the toilet.
Oh, see, that's rough whenever you run that route of when medication gets into play.
So between the pushing and the seeing the medication in the toilet and the things like that, and then already being called out there, and basically it's like consuming resources at that point.
Yeah.
They basically said, okay, we can take him. But I told them from the get-go, because they were like, you know, did he put hands on you? I said, well, he pushed me out of the way. They're like, oh, did he grab you? I said, he kind of like grabbed for me, but like he didn't really like grab me.
Yeah, this wasn't domestic.
Right, this was not domestic violence at all. No. But it got labeled that because they basically have to charge them with something.
Yeah.
To be able to take him into custody. And he said there was a scratch on my neck, which I told him was because we had one of my heathens.
Yeah, one of the dogs.
Yeah, one of the heathens. Yeah. So we were laying in bed together when we started getting in an argument. So she scratched me. Yeah. Just like trying to get up. But of course, with everything else, they have to look out. Because, you know, people that do go with domestic violence and stuff,
entirely.
They also say those same things, and they may or may not be true. So they put it on his record, and I told him, I said, I don't, like, this is not why I called you guys. Yeah. And they said, we have to charge him for something in order to be able to take him to the hospital for evaluation. Once he's at the hospital, and I knew this from working in the emergency department, they could choose to release him from custody.
Okay.
And basically it's like all charges are dropped.
Yes.
There were no charges. But the hospital has to not take custody of that person, but the hospital has to have like checked in that person, sign them that they're going to be evaluated. Right. Yeah. Like basically we're kind of saying like we're signing some kind of document 1013 or 2013 while we assess them and figure it out. And then we'll kind of go from there. If it's rescinded, then that person just goes on their way, just like if it was for anything else. So they told me, actually, they didn't tell me what hospital they wanted him to go to. I said, whatever you guys want to do. By that point, I was so relieved I did not care where they took him.
True.
Because I had felt like personally and professionally, so many things had happened by that point. There was no way that anybody would not see how psychotic he was.
Yeah.
And not like psychotic, like in a bad way, just like literally out of his mind.
Yeah, just the different person that he is. But you've seen the whole progression, but they're only seeing a small amount.
Right. And luckily, one of the officers that responded that night was the same officer that had responded earlier in the week. So he had kind of seen it too. Yeah. So I didn't even call. I literally went to bed that night because I was like finally relieved that he was going to get taken care of and I was going to deal with it in the morning. And I woke up at like 7 o'clock, which I work night shift in. So waking up at 7 o'clock in the morning is a big deal to begin with.
That is a huge deal, yeah.
And I woke up at 7 o'clock and I realized that there was a voicemail and it was from the cop that had taken him in. And he didn't really say anything on the phone, but he said, he came down to they tried to take him to the hospital, but the hospital wouldn't accept him. So they couldn't release him from custody. So they had no choice other than to take him to jail.
Oh, gosh. Oh, man.
And I was like, I couldn't even, I think I listened to it like 5 times because I was just kind of like, are you kidding me?
Yeah.
Are you kidding me? And then to miss the phone call on top of that as well, I was so mad I didn't even know what to do. And then around that time, my husband actually called me from jail. So when you get flagged for domestic violence, they end up like, once you finish processing, they flag all the numbers and everything else too. Yeah. But by that point, it hadn't finished going through. So he called me and I said, what's going on? He said, I don't know. I'm in jail and I don't know why. And I said, they were supposed to take you to the hospital.
Yeah.
I said, did they not take you to the hospital? He said, no, they did take me to the hospital. I said, okay, so what did the doctor say? He said, I didn't see a doctor. I said, what do you mean you didn't see a doctor? And he said, I don't know. And he was just so confused and distraught on the phone. He's like, I don't know why I'm here. He said, I don't have any of my medicine. He's like, I don't know what I'm going to do. And then the phone disconnected. Scary. And then because it was flagged as domestic violence, we couldn't make any other phone calls.
Because they didn't get processed at that point.
Right. Because it had flagged through as my phone number by that point, and so he couldn't call me anymore. So now he's sitting in jail, and we don't know why. I don't know why. I don't know what to do. The first thing I did was call my parents. And by that point, my parents had, like, no idea what had been going on.
Yeah.
But I didn't know who else to call because I'm like, I can't call him and get him out.
That's
because it's domestic violence. They're going to flag it. So I called my mom, hysterical. I told her what happened. I had told her what had been happening. They weren't like super surprised, which is really kind of funny because we never talked about it. Like I expected them to be like, oh my gosh. But, you know, it's like you always kind of have inklings.
As a parent, you have inkling. Yeah, you have that extra sense.
Yeah. So she said, is there anything we can do? I said, I don't even know. I said, I don't know what's going on. I don't know anything. And so she said, I think I like went over to their house or something. We like met at their house.
Okay.
And they were going to be down later or whatever. So I went over there. And because she was like, I don't want you to be alone. And I'm like, I have the dog. That was my thought. I have the dog.
I have something. Come on, there's someone here. Yeah.
And so we went over there and we were just kind of like waiting on a phone call.
Yeah.
I think he called through like one more time. He was able to get through like partially for like 30 seconds. And I was able to give him my mom's phone number. We just kind of waited. Like it hadn't been the first time that we'd had a family member that had been locked up for something. So I had known a little bit of the process by that point to not super freak out. Other than I didn't.
Still, it's mentally, now it's closer to home at that point now because you're the one having to do.
Well, and I didn't understand what did he mean by he didn't get seen in the hospital. Like that's what we had agreed upon.
That was the whole point.
Right. That was exactly that was the entire point of making this phone call was to get him taken to the hospital. Because you were trusting
the process.
Yep.
Yeah.
And so that cop was on like later that night. So I think I called at like 5 and somebody gave me his phone number. They looked up my husband's case or whatever and they gave me the officer's phone number and he had been trying to call me again anyways. And he told me, he said, he said, I didn't go in with him. My partner went in with him. His partner said that they tried to talk to the doctor about what had happened. And the doctor refused him and said that it wasn't mental health, it was domestic violence and he needed to go to jail. And I was like, how could that? I still was like so mind blown because I knew this physician.
That makes it challenging too when you know the individual too.
I didn't know exactly who it was at that point. I will say that. But I knew all of the physicians that were there at the hospital that he was in the emergency department. And I knew exactly what it had been too. It was because of the time of the shift change. Because the doctor's shift change at 6 o'clock. So typically at like 5 o'clock, they say that it's power hour. So they don't really like to get started with like psychiatric patients because they can't get them finished in an hour.
Within that last minute.
And he showed up at like 4:50 or something like that.
Oh my gosh.
Yeah.
That is crazy. The thing about, and that's part that stinks too, is as educators and everything in any industry, that last hour is always challenging. Yep. It's so hard. Because whenever something to bring to the end of something, you don't want to start it.
Yeah.
You don't go the process, or you know you can't do it.
Feel like you're not going to be able to finish it. You're not going to be able to see it through. And
you don't want to be there the extra time as well.
Especially with like legal thingies. You don't want to try and pass them on. Yeah. And
so because they're not going to understand.
Yep.
Yeah, they're just not.
So, so he said, the officer said that the guy, his partner that took him in, talked to the doctor, and the doctor said there was domestic violence and to take him to jail. And so the police officer said, so I'm not surprised that your husband said that he didn't speak with the physician because he didn't. Like, it was just cop to doctor.
Yep. It's 1, 2, 3. Yeah.
And so then I was like, oh my gosh. So I think that is probably like the next day or something, my parents came down and we were still just like waiting to get him out because we knew it wasn't going to be like within the first 24 hours.
No.
So we thought we would have heard something by like 48 hours. And my mom had called up there by that point. That's what happened. That's how we started trying to get information because they knew I told her that they weren't going to give it to me because it was charged as domestic violence.
Yep.
So she called up there trying to find out information for him. And he kept coming up as like unlisted.
Interesting.
And
so they're just like holding him at that point, but not actually like putting him in the
right. Like
system?
nobody could give her any kind of information.
Huh.
And so she pulled a string with somebody that she knew and was basically able to get word back that he was there in the jail and that he was safe, but they couldn't give any kind of other information.
Odd.
Right?
Yeah.
Super weird.
Yeah.
So by this point, I'm like, I don't know when he's going to get a bond hearing. Like they're trying to figure out like when they're supposed to be back down here because they already have agreed to bail him out because we've been saying from the get-go that it's not domestic violence.
Yeah.
I've already talked to like domestic advocator and everything at this point. Like I don't know why this charge is on here because this was never supposed to happen.
Yeah.
And everybody's just kind of like, there's just nothing we can do. There's just nothing we can do.
Hearing those words.
Yeah. Because I could be a victim. Even though I'm saying I'm not a victim, I could be a victim, kind of thing. So it doesn't matter. You can tell me to your blue in your face. It just doesn't matter because you have people that say that for other reasons where they are.
True. Yeah, you never can tell.
So we had to sit and we had to wait. We had to wait and we had to wait. And then I think I even like went it for a shift the next day because I was like, I don't want to be sitting here waiting for him to get out and like use time off for that. Like I'd rather use time off when he's actually home.
True.
So I went to work and I knew the secretary that was there and I was like, hey, were you here the other night? And she was like, yeah. And he said, listen, they brought my husband in at like this amount of time. Because I never called. I wasn't like, hey they're bringing him down there. You probably need to sign him. Right. Like I was kind of like, oh my gosh, like it's all going to get taken care of.
Yeah.
And she was like, oh yeah, I remember. She's like, they sat him right over there. And I said, okay, so just explain to me, why does he think that he never saw a doctor? Because literally EMTALA says that if somebody's requesting a medical screening for
they
you,
have to be able
you
to
have to. Yeah, which means that that doctor has to have a conversation with you.
Yeah.
And she's like, oh, well, he probably, and I don't remember all the details now either. I think he was even saying like, you're not going to make me a 1013 or something like that. Super not helpful.
True.
But also the simple fact that like, if you went and talked to him and you asked him, well, why did you get in a fight with your wife tonight? It would have come up. Oh, well, I was trying to debug the house.
Something would have came up.
Something would have come up that would have said, maybe we need to investigate this further because he was so out of it by that point that he wasn't really making a whole lot of sense in general. But it was a simple fact that they hadn't actually made the direct conversation with him. It was only by word of mouth with the police officer, which wasn't even the same police officer that I had talked to or that had responded. Yeah, it was the partner that had gone in with him. So it was just a whole bunch of like systematic things. So once I found that out, I was even more mad. Because I'm like, there's literally a law that says that you can't do this.
Yeah.
And so I took it up with the hospital like immediately because I was ticked.
I don't blame
It's bad
you.
enough that we have all of this going on.
Yeah.
It's bad enough on how much effort had to go into having that
Getting to
happen,
that
to
point.
get to that point, to make that phone call.
Yeah.
And then to tell me that it was literally all for nothing because you just didn't want to see the patient or didn't think that you needed to see the patient, I guess I should say.
Oh my gosh, I'm so sorry.
And the hospital couldn't even do anything about it because he was never registered at the hospital. So there was no proof that he was ever even there. So there wasn't any like take it up with a lawyer or anything like that because there was no proof that he was at the hospital other than just the people that saw him and the cops that took him there.
And they can choose to say X, Y, or Z at that kind of point.
Yep.
Oh, that is scary. So like, yeah, navigating anything, a challenge, navigating the healthcare system, navigating the like legal system.
And then the crazy part is that the reason why it took us so long to find information out for him is because when he was refused at the hospital and they took him to jail, they put him on psychiatric hold at the jail. So he was literally on a 72-hour hold at the jail for stabilization, even though they had tried to take him to the hospital for an evaluation to see if he was stable. So that he got his meds and stuff eventually at the hospital, or at the hospital, at jail.
Yeah.
He got his meds and stuff eventually, and they were remedicating him and things like that. But they put you in like a turtle suit. That's what he calls it, and it's basically like this big like foam like weighted vest.
Interesting.
So, and you just like kind of walk around, and there's like just like people that are, I guess that's what he said. I don't know. They were just like, you just walk around in your little turtle suit and that's all that you have. And then after that 72 hours, if you've like not been harmful and anything else like that, then it's basically you're cleared just like you would have been cleared at the hospital.
Okay.
So then he was like able to make bond and my parents were able to get him out.
But that was 72 hours of time.
That was 72 hours of time. And he then left with this domestic violence charge. So we had all of this like no contact order that we had to try to figure out how to navigate. He wasn't working. So it was like we already had to share income anyways.
True.
So our expenses have now just doubled for no reason because now I'm having to try and like find out where I'm going to put him in the meantime.
True.
Still pay the bills. We also still only have one car.
Oh
so
my gosh, that's just
it was a mess.
It
was a mess, and because of COVID, the court system was so backed up. It took like
that's true. Gosh, it was
almost 2 years, a year and a half. I think it was like 18 months or something to finally get it all put under the rug.
Yeah, I couldn't even imagine trying to navigate that, talking with advocates, talking with lawyers, talking with all that in order to make that work, and then having to basically just like hurry up and wait.
Yeah. Yeah. Oh, it was all hurry up and wait. Talking to the advocate, telling her literally this is everything that happened. And she's like, okay, well, he needs to talk to his lawyer. Okay, but like technically we can't talk to each other. We can't
communicate. Yeah.
Like we did.
But
I don't know whether I should say that, but like we did. It's already out and over with now. I don't care.
But still, like that.
Because we had there was no other option. We even had sold the house that we were living in.
Yeah.
Because luckily we had an opportunity come up to like move into my parents' house that they were moving out of. So he lived there for a while by himself while the house and everything was selling to try and wait for everything to kind of calm down and be swept under the rug. Yeah. By that point, we didn't know that it was going to be 18 months to take it all to get resolved either.
Gosh, yeah.
So we were kind of like trying to wait it out initially and just like do everything that we were supposed to do and keep the no contact and things like that. And I'd send money and they left a car or something like that for him to use for a little bit till it crapped out or whatever.
Yeah.
So
cars do that.
Yeah. So we tried to make it work for a little while and do everything they told us to do, but just got to the point where we couldn't do it.
Yeah. That's true. You can only sustain something for so long. Money only lasts for so long. The judgment of
even just
making that work.
And then too, it's just even like that's hard enough to do even if you're like in a domestic violence thing or not. But then when you throw mental health on top of it and like trying to coordinate doctor's appointments, trying to make sure that you have the right prescription, trying to make sure that we're able to pay for this medication, trying to remind you to take it and things like that, to have actually somebody manage your care, it was like
otherworldly.
It was detrimental.
And gosh, trying to navigate that, especially when getting medication right. I know of seeing from firsthand experience is you may try 10 medications before one thing fits.
Yeah.
For one thing, and it may work for 6 months.
Yep.
And then it stops. And trying to navigate all of that in the healthcare system and then the legal system on top of that, I couldn't even imagine what you went through. And especially when it comes to like insurance stuff as well, because I bet he was under your insurance.
Because he was employed.
How in the world do you navigate that if you have a domestic violence dispute here that technically shouldn't be there? And then you have a no contact, but they have your insurance and they have oh my gosh.
Yeah.
And that is where we're going to take a pause in the conversation. I believe this was the perfect spot to be able to continue our conversation in 2 weeks with Tori as we go into a little bit more detail about what took place, the resolution, and then she's going to give us some advocacy information dealing with insurance and just to be able to get some more locations of information for those that are curious. There are going to be some links below, so if you want to be able to get a look, to be able to find that next location after listening, they'll be down there in the links below. If you would like to reach out to me, my email is cade, which is spelled CADE, at learningfromfriends.com. I also have a Facebook page. I have a LinkedIn page now, so go get a look at that. I also have an Instagram page. Totally new as well, to be able to go and be able to reach out to me those ways as well. Best is definitely by email. But what I would like to ask is if you're liking the podcast, write a review. Just to be able to help share a little bit more of those that are coming looking for podcasts and trying to understand, hey, is this one worth it or not worth it listening to? And if you're feeling moved enough, come to my Patreon page. It's Learning from Friends podcast. You can be able to go and donate there's 3 different levels. I've got a $5, $25, and $100 level. All of these go a long way in just making a little bit of contributions to making this podcast remain the way it is right now. Because again, I teach, and this is something that I do on the side for fun. And it's not required, but it would be nice. So please take that into consideration as you're finishing up this episode today. So as we leave here today, good old catchphrase here. My name is Kay Curtis, your tour guide in this lovely adventure I like to call Learning from Friends. And most of all, don't forget, let your curiosity fly high.